Dr. Carol Paris. She is a recently retired psychiatrist, worked for more than 25 years in private practice, community mental health, prison psychiatry, and academia. In the course of her experience, she became an outspoken critic of the private insurance-based U.S. healthcare system. She is credited with identifying a new psychiatric epidemic, PIISD, pronounced PIST. Private insurance-induced stress disorder. It's real. After closing her practice, Carol worked for a year as a locum tenens psychiatrist in New Zealand and has experienced firsthand how much better a single national healthcare system can work, both for physicians and for patients. Dr. Paris was one of the Baucus 8. I would like to rename this group the Raucous Baucus Caucus 8, if I could get away with it. This group was arrested one at a time as they stood up in the gallery of the hearing room of the Senate Health Committee to protest the decision to exclude any discussion of a single-payer plan in the run-up to the Affordable Care Act in 2009. Yes. Dr. Paris was recently elected to a 2-year term as president of PNHP, our national parent organization. She lives in Nashville, Tennessee, and her most recent activism event was appearing at a Trump rally there. You might remember a month or so ago. He had to just get out and have a rally. So he picked Nashville. That was his mistake. She unfurled a Medicare for All banner that she smuggled in up her sleeve and started chanting the slogan, Medicare for all, Medicare for all. She did draw attention from Mr. Trump, who said, I know what's going to be in the newspaper tomorrow, and then was escorted outside where she was interviewed by the media. Nicely done. Her friend Margaret Flowers describes Carol as a tireless, outspoken, and humorous activist. I can attest to all 3 adjectives, as Carol has visited in my home these past 2 days. Let's hear from her now.
Would you open a bottle of water for me, please?
Sure.
Thank you.
If I can.
If you can. Well, I'm very pleased to be here. It was such a treat to be invited by Sherry and David. And then when I heard that John Guyman was going to be here, and then when I heard George Lakey was going to be speaking, I would have walked here from Nashville if I had to. So, I am humorous, I think, and I'd like to tell you a little story, because I think we have to control the narrative. We've got to stop reacting to things. Doesn't work. So we need to control the narrative. And I'm going to paraphrase one of my favorite poets who lives just down the road, I think, on White Island, David White. I mean, on Whidbey Island. And what I'm going to paraphrase is the end of one of his poems, where he says, any narrative that doesn't bring you alive is too small for you. And I want to tell you about a narrative that was too small for me the day I was born. I have a twin brother. And the day we were born, and this was prior to Facebook and Twitter and Instagram, just a few years, my father sent a telegram to the family that said, the boy was a gentleman. He let the girl go first. I was the firstborn. I want to tell you that this is a narrative that did not bring me alive when I got old enough to understand what it implied. I'm sitting around waiting for my brother to say, oh, After you, my dear. I don't think so. In fact, I want to tell you I am absolutely taking control of the narrative, and here is what really happened. Because my father was not in the womb. My mother went into labor, and I said, out of my way, I have places to go, people to see, and things to do. And it hasn't changed much in the next 64 years. But that doesn't mean that I came out of the womb as a single-payer, Medicare for all, sign-holding activist. And I actually grew up in a family that thought girls should marry doctors, not be doctors. So I had to work on that a little bit. And then I finished medical school as an older physician, older medical student. And I really was, in those days, we didn't learn a whole lot about the healthcare system. And I'm so glad to hear Simran saying that they understand it's important to learn what the system or lack of system is that we have so they can create something that's going to help them to become mid-career and late-career physicians who are not tired and angry and burned out. I will digress for a minute and tell you that the Surgeon General last year, his two biggest concerns were the opioid epidemic and physician burnout. So it's a real thing. But I thought, well, you know, when I finally got into a private practice and put on the business owner hat as well as the physician hat, boy, were my eyes opened, and I thought, this is crazy. We've got to do something here. And I started working with the Maryland, I lived in Maryland, and I started working with the Maryland State Medical Society. And we passed a piece of legislation that silly, naive me thought actually was going to, in a small way, get the insurance companies to play fair. I said, naive. 2 years later, guess who had written the regulations? The lobbyists for the private insurance industry. And it was at that point that I threw my hands up in disgust and said, there has got to be something better. And my friend said, well, have you met Margaret Flowers? And do you know anything about Physicians for a National Health Program? This was in December of 2008, and as you know, in 2009, Barack Obama became president, and I began a 6-month mentorship with Dr. Margaret Flowers. I would come home from work every night and just study, read everything I could about healthcare reform so that I could understand, finally. It was like, remedial healthcare policy 101. And then it was, as Sherry pointed out, May of 2009, and Margaret called me one evening and said, what are you doing on Thursday? I said, oh, I thought I was going to go to work, but what did you have in mind? And she said, well, how would you like to go to the Senate Finance Committee, and you might get arrested. And I said, with you, Margaret? Sure, what the heck. So the way we worked this gig, and here's where I really want to make the point that if you're going to do activism, make it work. I don't do anything impulsively and born of passion. I do it for political theater, and I do it to get media, and I do it to get a message out, build the movement, okay? So we were just learning in those days, but what we did was we made sure that all 8 of us were in the middle of aisles, so it would take the Capitol Police a little longer to get to us, so we would have more time to say what we wanted to say. And of course, I had a 3-page epistle that I was going to say, and Margaret said, you know, Carol, I really don't think you're going to get to say that much. So I ran to the bathroom where I do all my best thinking and came out and we started. So Max Baucus pounded the gavel, and the first person got up and interrupted him and got arrested and taken off. And I was the fourth person, and by this time you could tell that Senator Baucus was getting a bit peeved with these pesky people. And I decided I would use humor. So he finally got the group started again, and now it's my turn, and I stood up and I said, I interrupt this so-called public hearing to bring you the following unpaid political announcement. Put single payer on the table. My name is Dr. Carol Paris, and I approve this message. The whole place burst out laughing, and then Grandma Carol, in her little black suit with her pearl necklace and little black pumps and gray hair, got arrested and ended up on the cover of Michael Moore's homepage, surrounded by Capitol policemen, because it took at least 5 people to restrain me. Yeah, right. Well, 6 months later, when we were off probation, the president had his State of the Union address in January of 2010, where he said, if you have a better idea, let me know, let me know, let me know. Well, we decided we were going to let him know. And this time we learned something from the first experience, which was that we hadn't brought a videographer with us. And we had some pictures taken, so there was that. But we really missed out on the media opportunity, because of course we know that the mainstream media is not going to give us any airtime at all. So this time we brought a videographer with us, and what we were planning to do was stand outside of the Harbor, Baltimore Renaissance Harbor Hotel as the president's motorcade drove by, because he was going up to visit, to meet with the Republican caucus. And so we pulled out our sign that said, letting you know, Medicare for all. And the security people came over from the hotel and said, you ladies are trespassing, you have to, be nice little girls and go over there. And we said, but if we go over there, the president's not going to see our sign, and people are dying. We have a better idea, and we have to let the president know. He asked us to let him know. They were not impressed. So they sent over the Baltimore police. And, here comes the Baltimore police, and we're supposed to be real scared. And he says, if you don't move over here, we're going to arrest you. And I said, well, you do what you have to do, we'll do what we have to do. And I could see this guy was really frustrated. And I said to him, this must be really frustrating for you. I'm a psychiatrist. I can't help it. And he said, yes, it is. Would you just go over there? I said, I can't go over there. The president won't see us, and people are dying. We have a better idea. So then they thought, well, if the police aren't going to scare us, the Secret Service are definitely going to scare us. And here comes the Secret Service guy, and he said, go over there. We said, no, sir, we're not going over there. But we've got this letter for the president, and if you would deliver it to him, we'll go away. He said, I am not the Postal Service. Okay, well, we're not going over there. So they arrested us, and we unfortunately did not get to deliver our letter to the president, but what we did manage to do is have a complete videotape of the whole thing, which ended up being shown on Democracy Now! The next day, segments of it, which Bill Moyers of Bill Moyers and Company saw. And I came to work the next day, and my office manager said, Dr. Paris, there's somebody from Bill Moyers on the phone, and they want to see if you would go to New York to be on the show. Either you or Dr. Flowers. And that was the point at which I said, oh, I'll be glad to tell them Margaret can go. But the point I'm trying to make is activism is, direct action is what we need to be doing. And we need to do it strategically. I did not engage in direct action from 2010 until 2017, just last month, at the Trump rally, because there really was not, it would not have served any useful purpose. I did do movement building in other ways, and I kept my eye on opportunities. And when the opportunity presented itself, and it seemed like I could get some additional cachet from it, I was willing to go ahead and engage in another direct action. And what that was standing in line at the Trump rally with Trump supporters for 5.5 hours, which was really an interesting experience, and I'm so thankful for it. I stood with a woman and her daughter who said, you know, my husband couldn't be here. He so wanted to be here because he so wanted to hear the president speak. But he has lung disease, and it would be too hard for him to breathe. And so we talked about that, and I shared that my father and mother both had passed away from various lung diseases, and I know how sad it is to see somebody struggle for breath. And at that point I said, you know, I've got to go charge my phone. Would you keep my place in line? And I'm just going to run up the street and charge my phone. And they were like, oh yeah, sure, fine, no problem. And then some Bible-thumping people with megaphones came walking by and shouted in our ears for, honestly, it felt like 2 hours. And all of us, me and all the Trump supporters, wished that they would just go away. So then it's getting close to time to go in, and the protesters start walking by. And I've now been with these Tea Party Trump supporter people for 5.5 hours. And when I saw some of the signs that people were carrying, I was offended. As something had happened to me in that 5.5 hours of just being in another person's reality. And I was offended by the rude, just snarky, unkind signs. So, my opinion, leave those kinds of signs out of your efforts for Medicare for All. Please do me that favor. It doesn't help. Make a sign about what you're for, not who or what you're against. It just doesn't serve any useful purpose. So when I did get in, I did have a resident in vascular surgery who said, Carol, I really can't get arrested. I said, you don't have to get arrested. You don't have to do anything except catch this all on your flip phone, your smartphone, and then upload it to Margaret Flowers in Baltimore as soon as I get either arrested or kicked out, and take my business cards over to the press table and distribute them. Because again, I am political theater from start to finish. I want to get as much press out of this as I can. And that's exactly what happened. I stood in the first 2 rows, and I made sure that I was close enough that the president would be able to hear me if I shouted loudly enough. And the press table was right over there, and they had a good view of me as well. And when the president started talking about healthcare reform, I pulled my sign out that said improved Medicare for all, and I just held it over my head, and I said, put your name on a plan that works, Medicare for all. I didn't say you're a jerk, you're anything. I said, I've got an idea. Put your name on something you can be proud of, and I'll be proud of you if you do that. So I just kept saying it over and over again. Put your name on a plan that works, Medicare for all. And I was able to chant that enough times that the president actually did have to kind of stop what he was talking about and look over and kind of, like, go away. And the Trump supporters were told not to touch any protesters, which they did not, and to just shout Trump, 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 which they did do, and then I was escorted out, and the video got uploaded to Margaret. The press box got my cards. I went outside. I wasn't arrested, so I got to talk to all the press outside before anybody else did. And on the way home, a reporter from the Tennessean was already calling me because Margaret Flowers had called him, and an article appeared in the paper the next day. So, again, I enjoy doing this kind of thing. It's a way that I can contribute to this movement that is fun, and I enjoy doing it. That isn't for everybody, and goodness knows we need helpers and organizers. We need people who are organizing all the other things that have to happen to build a movement that I think I am so eager to hear George talk about. Because what I can say about PNHP is that I think we really need some help in broadening our strategy, in finding out what we need to do that's going to work. Because I love a lot of the sayings in AA, and one of them is, if you always do what you always did, you'll always get what you always got. And PNHP has been giving PowerPoint slide presentations to physicians for 35 years. If policy and data was going to get us single payer, I think it would have by now. We need that. We absolutely need that. We're going to need it even more when we pass the legislation, because we're going to need to do this right. So I'm going to just finish up by saying the other really exciting outcome that I think this latest action contributed to is that I live in Nashville, Tennessee, where Jim Cooper is my congressman. He's a Blue Dog Democrat. He has never co-sponsored H.R. 676. I met with him. I spoke to him at one of his, he didn't call them town halls, but something like a town hall. And I asked him to co-sponsor, and he danced all around the subject. And then I said, well, I have an appointment with you in 10 days and in your office. So I'm going to be talking to you about this some more. And in that intervening 10 days is when President Trump came to Nashville. So by the time I showed up in Jim's office, he said, weren't you scared? And I said, well, sure, I was scared, but come on, I'm white, I'm 64 years old, I'm a woman, and I've got gray hair. I mean, who's really gonna beat up Grandma Carol? Give me a break. So yes, I was a little nervous about it, but again, it was a calculated risk. And then he started talking about healthcare reform, and we got around to what happened in 2009, and I said, well, yeah, I was one of the Baucus 8, one of the people that got it. And he said, oh, so this wasn't your first rodeo? I said, no, sir, it wasn't. I'm really serious about this, and I'm not going away, and I live here. 2 weeks later, I had another appointment in his office on Good Friday, and he said, Carol, I'm co-sponsoring H.R. 676. He also said, this doesn't mean as much as you'd like it to mean. And I said, what do you mean, Jim? He said, you've got a lot of work to do. And I said, tell me, I really want to know. He said, you've got to get business on board, and you have got to get bipartisan support. You've got to get Republicans. I said, who should I start with? And he said, Charles Dent of Pennsylvania. I said, yes, sir, I will start on that tomorrow. And we are working on it. I'm also happy to say that there is a new campaign that is being sponsored by the American Sustainable Business Council, and the campaign is called business leaders transforming healthcare. And it's a campaign that's being started by Richard Master, who is the person who wrote the documentary Fix It and has now come up with a second one on the pharmaceutical industry. And he is championing a national health program because he gets it from the business perspective. Healthcare as a human right is nice, but what really matters to him is that it's going to save him a whole lot of money and allow him to provide really good health care for his employees who are going to show up for work more because they're healthier. Guess where he lives? Charles Dent's district. So it's like, I don't know, I can get philosophical sometimes, and I just feel like the universe is saying, we're just gonna, you just keep showing up, Carol. Just keep doing the next thing that seems like the right thing to do, and you don't have to know how it's gonna turn out. I'm just gonna, just keep showing up, and it's just gonna keep moving in the right direction. And I'm gonna finish by saying, this is unstoppable, and now is the time for Medicare for All. Thank you.